He's got to take a deeper breath. He has to use accessory muscles to pull air in. Well, he's going to have just as much trouble getting air out once he pulls it in because the airways are narrowed. So in order to do so, he has to use accessory muscles of expiration, which forcibly make the thorax smaller and forcibly makes the lungs smaller to push air out. So the internal intercostals, they're not used during quiet expiration. That's a passive process. But to force air out, you can contract the internal intercostals. The internal intercostals, remember, their fibers run in a different direction, so that they originate from the lower rib and insert onto the upper rib. They pull the upper rib down. And in pulling the upper ribs down, it's like pulling down a handle on a bucket. That space that's created by elevating the rib, okay, is now lost. You're making the thorax smaller. You're forcing the lungs to be compressed and push air out. So, internal intercostals are considered accessory muscles of expiration. They force air out. Now, in addition, the abdominal muscles, the abdominal sheet muscles, all four that are listed here, the rectus abdominis, the external obliques, internal obliques, and transversus abdominis, all four of those muscles that line the abdomen. You know these muscles that come down like this, that form the six packs? Okay? Those are the rectus abdominis muscles. Rectus means straight. So these are the straight muscles of the abdomen. Okay? It's these muscles here. And then lateral to the rectus, you have three large sheet muscles. The external abdominal obliques that are on the outside. Then just deep to that are internal abdominal obliques. And then deepest, you have transversus abdominis. So there are three different layers of sheet muscles that sit lateral to the rectus abdominis. So all of these abdominal muscles, though, when they contract, they increase intra-abdominal pressure. They compress the abdomen, they elevate pressure, and they push up on the diaphragm. So all of the abdominal muscles can be considered accessory muscles of expiration. Okay? So the abdominal muscles as well as the internal intercostals all have that function in common. They can cause forced expiration. They're accessory muscles of expiration. Now, we've talked about the internal intercostals. Okay, they're innervated by the intercostal nerves. Let's talk about the rectus abdominis. All right. The rectus abdominis, it originates from the pubic symphysis and pubic crest, and it inserts up here around the xiphoid process, okay, and costal margins here. Okay, so the origin is considered the lower part of the muscle where it originates from the pubic symphysis and pubic crest. It extends up toward the xiphoid process where it inserts. Okay? So the xiphoid process and the costal margins of those lower ribs. Now, we said that when the rectus abdominis contracts, it compresses the abdomen. It pushes up on the diaphragm. So it can be used as an accessory muscle of expiration. But it can also be used to flex the lumbar spine. To do this. Like you're doing a sit-up. Okay? So one of its functions is also flexion of the spine. And if you read this here, see where it says rectus abdominis. It says flex the lumbar region of the vertebral column and increases intra-abdominal pressure. Here we see its insertion to the xiphoid process and costal margins here of these ribs. Okay. Notice there are horizontal bands of connective tissue that create segmentation of the muscle. It gives that six-pack appearance. By the way, they're shown on this slide, okay, I know by direction of the fibers that this is the external intercostals, okay? And when the externals contract, they bring the ribs up. Okay. Let's talk about the other abdominal muscles, the sheath muscles of the abdomen. See if they're here somewhere. Yeah, ladies, this is for you. That's the six-pack everyone's looking for. Here we go. This sheath muscle right here. Okay. Now notice, by the way, that the rectus abdominis is covered by a sheath of connective tissue. This is called the anterior sheath of the rectus. Okay. It's formed in part by the aponeurosis of the external abdominal oblique muscles. See, these muscles don't have a tendon. Okay. They're surrounded by an epimysium that, when it extends beyond the muscle, forms a sheath that contributes to this anterior rectus sheath. It's an aponeurosis. Okay? Now, for these sheath muscles of the abdomen, I'm not going to ask you their origins, because as you can see here, they're going to originate from multiple sites. Mostly, in this case, the external abdominal obliques is going to be from ribs, but it's a little bit too difficult to memorize. I want you to be able to recognize the muscles when you see them on a model, though. Okay. But you can see that they're originating from multiple costal surfaces, and the fibers are running just like the external intercostals. The fibers are running like this. So external intercostals, external abdominal obliques. The fibers run in this direction. Okay? So that they ultimately are going to attach via this aponeurosis to a band of connective tissue that runs from the xiphoid process to the pubic symphysis. This band of connective tissue that serves as the insertion of the external abdominal obliques is called the linea alba. Linea alba, which means the white line. Okay? So you can see the external abdominal obliques are originating from costal surfaces, and the fibers are moving forward. They form this aponeurosis, which then connects to this linea alba in the center. Now, if you look at your handout, it says external obliques. When both muscles contract together, they aid the rectus abdominis in flexing the vertebral column. In other words, flexing the lumbar spine, and in compressing the abdominal wall. Acting individual, each muscle produces lateral flexion of the trunk. What does that mean? Well, you ever see people who, when they do their sit-ups, instead of just coming forward, they begin to bend? Okay? Well, by flexing just one side of these abdominal sheath muscles, you can cause that type of truncal flexion. Okay? But again, flexion of the lumbar spine and compression of the abdomen. That function is going to be same. It's going to be same for all of these abdominal muscles. Okay? If we go deep to the external obliques, see if I have it here. Here. Okay. This is the external abdominal obliques here. If I go deep to that, if I cut that away, like I have here, this is the internal abdominal obliques. The fibers, instead of running down like this, they're running up. Okay? Again, I'm not going to ask you origin. Okay? But they do insert upon the linea alba. These are sheath muscles. Okay? Now, if I cut away the internal abdominal obliques, I come to a third layer in which the fibers are transverse or horizontal. This sheet muscle is called the transversus abdominis. And again, it's going to insert upon the linea alba. It's going to have an aponeurosis through which it inserts upon this linea alba. Again, all three of these sheet muscles, the external abdominal obliques, internal abdominal obliques, and transversus abdominis, same function. Compress the abdomen, flex the lumbar spine. Okay, so that's easy. You're not going to need to know their origin. You just need to know that they insert upon the linea alba. I'm not going to ask you their innervation. But I do want you to notice, this is the abdominal wall in cross-section. So, this is your rectus abdominis. This would be your external abdominal obliques, internal abdominal obliques, transversus. Notice that all three have an aponeurosis. Now, here's what I want to point out. The aponeurosis to the internal abdominal oblique splits into two segments. The anterior section joins the aponeurosis for the external obliques to form the anterior rectus sheath. The posterior segment joins the aponeurosis from the transversus to form the posterior rectal sheath, or rectus sheath. These two rectus sheaths come together in the midline to form the linea alba. Okay. So, the most important thing is to recognize the insertion to form the linea alba, to recognize the muscles when you see them on a model, or when you dissect the dogs next semester. This year what we did is when we dissected the abdominal wall, we went ahead and dissected free all three layers of the abdominal wall so that you can see the external obliques, the internal obliques, and the transversus. You know, if you have surgery on your appendix and they make a small incision, let's say in the left lower quadrant, somewhere over here, okay, they have to incise through the skin, the subcutaneous tissue, and then through the external obliques, internal obliques, transversus, and then through the peritoneal membrane, the parietal peritoneum. And so it's important that they dissect each layer nicely, because when they close up, they have to close in layers. They have to close peritoneum to peritoneum, transversus to transversus, internal oblique to internal oblique, external oblique to external oblique, skin to skin. They open and close in layers. So they have to really define nicely each layer. Okay? Because otherwise you'd end up reattaching the, let's say, transversus to the internal oblique, and that would lead to some problems.
So how do they close back up the layers? Like,
well, if they open them up neatly, then it's easy to suture them individual.
Okay. And then they just heal on their own and the
Right,
suture
right.
dissolve?
Right, would happen, right, that's correct.
Okay.
Okay. How are we all doing with this? Not too badly? I think I'm going to mention two more muscles now. And then we'll just kind of quickly look at some models. You know what this little muscle is called? We've talked about it before. You may not remember. This is the pectoralis minor. Now, I know a lot of ladies like to see six packs, right? And maybe you're into pecs. But when you think of a pec, you think of the pectoralis major. Okay? You're not thinking of this little muscle, which sits deep to the pectoralis major. This is the pectoralis minor. It originates from the coracoid process of the scapula. You remember that little hook-like structure? We said that it serves as an attachment for the pectoralis minor and one of the biceps tendons. So the pectoralis minor originates from the coracoid process of the scapula, and it typically inserts upon ribs 3, 4, and 5 through 3 different little muscle slips. Okay? Now, what is the function of the pectoralis minor? It's got 2 different major functions. Okay? These attachments to the ribs can serve as the origin And at its insertion, the coracoid process is going to pull the scapula forward. Okay? Okay. So it can keep the scapula close to the rib cage, so it doesn't wing out, it doesn't project out. So it protracts the scapula. It brings it forward against the rib cage. But when you reverse the origin insertion, when the origin is the coracoid and the insertion is the ribs, it can serve as an accessory muscle of inspiration, just like the sternocleidomastoid. It can pull up on these ribs, 3, 4, and 5, to help expand the thorax. You do not need to know the innervation of the pectoralis minor, only its function. Okay. Let's go back. By the way, you typically can't see the pectoralis minor contracting like you can the sternocleidomastoid. If you work in an emergency room and you're writing a history on a patient, let's say to be admitted with severe asthma, the doctor or PA, whoever it is, when they write the history, they'll make note of whether the patient is using accessory muscles. So when he writes the part of the exam or dictates the part of the exam that involves the lungs, he'll say the patient is using accessory muscles of inspiration if he sees the sternocleidomastoid flaring with each breath in. If that kid contracts his abdominal muscles trying to push air out with each breath, he'll note in his physical the patient is using accessory muscles of expiration to breathe, to ventilate, to move air. So this idea of accessory muscles is important because as that child then begins to breathe more freely with treatment, they'll stop using those accessory muscles. Okay? So you know then that the child is improving. Then the last muscle I want to bring up today is the serratus anterior. All right. This is the serratus anterior. Okay? It attaches to the chest wall to about the first 9 ribs. That's actually its origin. Its insertion is to the anterior part of the scapula, to the anterior wall of the scapula. Okay. So it's going to cause protraction. It's going to pull the scapula forward. It's going to fix it in place. Now, you may be familiar with the serratus if you ever watch bodybuilding competitions on television. Because what they'll do is when they're doing their posing, they'll suddenly go into this pose where you see the muscles from the chest flaring out. Okay? That's the serratus anterior. Now, the serratus anterior, remember, it's going to pull the scapula. You know, these muscles are originating here, and they're pulling on this anterior wall of the scapula to bring it forward. And do this. Okay, kind of rotating it and bringing it forward like this. And it's going to hold the scapula, the shoulder, in place so that you can abduct the upper extremity and even punch or move forward. So it holds the shoulder in place for movements of the upper extremity. So for that reason, it's called the boxer's muscle. It's called the boxer's muscle. It stabilizes the shoulder so that you can move the upper extremity. You would do the same thing if you're doing push-ups, by the way. Any type of horizontal movement of the arm that requires abduction at the shoulder, you're fixing the scapula with the serratus anterior. So that's why it's called the boxer's muscle. You're fixing the shoulder while you're pushing the arm out to punch. Now, we're going to stop there. And what I'd like to do then is on, what's the next class? Friday. We'll cover the muscles of the upper extremity. But what you want to do in the interim is you want to look at these models of the muscles and make sure you can identify every muscle that we've talked about on that list. Or here, you could go to skinny. Red indicates origin. And so what would this be the origin to what muscle? Temporalis. Blue, insertion. What is this the insertion of? The masseter, right. Origin of what here? Well, sternocleidomastoid, yeah. This would also be sternocleidomastoid right up here. Okay? Origin of what here?
Is that the double?
Pectoralis minor. Pectoralis minor. So, if you look at Skinny and look at your book and your handouts, you can kind of piece it together. The muscle test is not going to be extremely hard as long as you put the time in just to learn the muscles. In fact, I would say this is more equivalent to the bone test, which I didn't think was too hard. It's too difficult. But if I ask you, what is this structure right here? What would you call this? Anterior rectus sheath. Remember, it's formed by fusion of the aponeurosis from the external oblique and the internal oblique. And then behind that, you can have a posterior rectus sheath. Remember, this would be the posterior rectus sheath, formed by the fusion of the aponeurosis from the transversus and, again, internal oblique. All right, I think that's enough. You can, with muscles and bones, you can only cover so much in one day, and that gets to be a little bit too confusing.
No.
All right, so you guys are free. We'll finish up with